my name is Mike Steinmetz. I am the chair of the Department of Neurological Surgery at the Cleveland Clinic Lerner College of Medicine. You are listening to the Interview with the Surgeon with the Surgeon Agent.
On this episode of Interview with the Surgeon, we welcome Dr. Michael Steinmetz, Chair of Neurosurgery at Cleveland Clinic. His areas of expertise and research interests include complex spine surgery, minimally invasive surgery, spine trauma, and spinal cord injury. Dr. Steinmetz is the author or co-author of more than 100 peer-reviewed manuscripts. He has written numerous book chapters, authored 2 textbooks, and edited 2 more. He serves as the Vice President of the Congress of Neurological Surgeons, Secretary of the Council of State Neurological Societies, an Executive Committee member of the AANS-CNS Section on Disorders of the Spine and Peripheral Nerves, and involved with the American Association of Neurological Surgeons, the North American Spine Society, and the Society for Neurosciences. He's on the board of directors of the NeuroPoint Alliance.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Mike Steinmetz, Chair of Neurosurgery at Cleveland Clinic. Doc, how are we doing today?
Doing great. How are you doing?
Doing fabulous. Thank you for joining us. So let's jump right into it. What were your goals and aspirations during your residency, and how have those changed throughout your fellowship?
Yeah, so great question. I think when we get started in any residency, especially neurosurgery, I think the first goal is just survive, right? You're sort of the so-called cliche, drinking from a fire hydrant, and at tenfold when you're a neurosurgery resident, you're just jumped right in to critically sick patients, immense pressure, need to multitask. So I think the goal when I first got into is let me just see if I can get into this sort of field and survive. As you sort of get, stable, more comfortable, I think then your goals sort of change to, okay, I want to not only be, the best doctor, but how can I be the best surgeon? What do I need to do in my training program to hone my skills, to develop better hands and be able to manage these complex surgical situations throughout, my training period. And so I think you sort of evolve from just getting in and surviving to now, what do I want to do and how do I become the best at it? And our whole mantra is we were the best and top doctors in the hospital when we were residents, and how do we maintain that? How do we maintain that moving forward? It then changes then, okay, now I need to focus on a career, so then my goals were, all right, what do I enjoy doing? How am I going to, immerse myself and then become move towards that, subspecialty type person as I move through my training program. And early on, it wasn't just becoming a better surgeon, how do I develop myself, in that field? We always said when I graduate, and we talk to our residents the same way about this, we want to have them develop a portfolio during their entire training program so that for me, I wanted to be a spine surgeon. So I not only wanted to hone my skills as a spine surgeon, so when I graduated, I felt like I was advanced more than other people that trained in the country. And that's just through reps, through doing as many cases as I can, complex, simple cases. But I also wanted to start sort of my academic background. So I wanted to start writing early. My mentor, Ed Benzel, always taught me write early, write often. So I started to try to publish very early and sort of develop that portfolio or niche for myself as I longitudinally moved through the program, so that again, when I graduated, I was already sort of somebody who potentially my name was sort of known or associated in the spine surgery or neurosurgery world. And so I think my goal was to start that early and longitudinally move through my training program. Because I think when I look back on trainees, what they lose is they will often put off till the end, the sort of the research end, and then it's too late. Now you're graduated and you can't go back and do that. So I wanted to start that early and then move that, through my training program. And then obviously I wanted to get involved in organized neurosurgery. I was among some that got involved very early, say with the Congress of Neurological Surgeons as a trainee. And I wanted to sort of continue to move up through my training program. So those were some of my goals as I moved through my training program. How do I get involved? How do I develop a reputation? I want to present at multiple meetings. I want to sort of have that name recognition so that I could springboard out of my training into a good academic job. And as I got into fellowship, then I think your goals change as a fellow. You sort of come out of your residency. Hopefully, you've sort of built that pedigree. You've got a little bit of name recognition. People know who you are. You've got people behind you, sort of your fans that are pushing you along, your mentors that are pushing you in different areas research, organized neurosurgery that recognize what you're doing. And then I think when you get into fellowship, you should be a person that, again, you're not going to fellowship to learn how to do a subspecialty. You already kind of know how to do that. You're using that time to fine tune those skills. Let me do it better. Let me see how other people do it better. What can I learn from multiple different people in my fellowship, improve my clinical skills, and still try to maintain some of that academic productivity during that time. That, your fellowship time is typically very limited, right? It's a year, it's maybe 2 years. So you're trying to fine tune everything during that time. So when you get out and you're in your first job, you're already established. People know who you are. Maybe you're involved in committees. You definitely have an academic background, and you've got the clinical skills to sort of set yourself off into a phenomenal career in neurosurgery.
That's really great advice. Now, taking us through that fellowship year, what was your mentality heading into your first job search, and how that perspective changed in the beginning years of your career?
Yeah, I mean, I think you just don't. I don't think we were very prepared for that first job search. You know what I mean? I think you look around you and people that got into a first great job and they were stable and loved it. And you sort of knew how well they were doing. And then colleagues or trainees that were a year or two above me got into a job and left within the first couple of years. So I thought, my first job search, I was trying to figure out what I really wanted. Was it an academic job? Was it a private-demic job? Was it in a university setting or not? And so I tried to put those sort of thoughts in my mind to try to understand, what am I really looking for? And what's going to fit my needs? And I'm going to go out and look at those jobs and try to have sort of a set of buckets of, does it fit what I'm looking for? And so what we always tell our trainees, we want to sort of have a set of like 3 buckets where, these are the things that, you had to have in a job no matter what. And, maybe it was location, maybe it was salary, maybe it was how the compensation plan was developed. For me, it was, research time in academia. Could I get a startup package? What would it look like? What could I get a job where as a spine surgeon, I was just doing spine surgery? Did I still need to take trauma call or elective neurosurgery call? Then we had things like that kind of really were needed, but I could negotiate around it. If I got this, I could negotiate maybe away from that. If I got that, they were sort of that middle bucket. And then there were things that I could ask for that I really didn't care, but if I never asked, I never would have got it, right? And so I sort of looked at a job like that in those 3 sort of buckets and used that to frame my thought process around really where I wanted to go. Now, for me personally, I trained at the Cleveland Clinic, which phenomenal training, and was offered a job, but even before fellowship to come back. And so I didn't look at a number of jobs, when I took my first job. I kind of knew what this environment was and what they were going to offer me, and I took it, and so I didn't look at a number of jobs, but I did need to make sure, especially coming back from a place I trained, where you're often viewed as always the resident moving forward. And I think, we talk to our trainees and other trainees. There's a comfort of taking a job at a place you trained because you know it and everybody knows you. The downside is you're always the junior person, right? You're always the resident. People call you by your first name the day one you start, as opposed to Dr. Steinmetz in my case, and that goes on for a whole generation of residents. And it can be a little bit, I guess, demoralizing, as opposed to if you went somewhere else where you never were known. Right now, you always have that kind of a little higher level of respect, I guess, so to say. And so I think that's something that has to be considered. But I thought I could work through that when I took this job and looked at the upsides and downsides and thought, this was the place for me, and I'm still here. So I guess it worked out for me taking this job.
So seeing that you took the job back at Cleveland Clinic, during that time, did you ever consider going private practice? Or were we really academic focused all the way?
Yeah, I did, because when I was in training, I was 100% academically focused. I thought there was never a chance I would deviate from that. But I certainly thought about it. There's a lot of things that are beneficial, I think, for private practice. Obviously, one is financial, right? Second is autonomy. And the ability to really build something, I think, on your own, especially if it's your practice or if you're in a smaller practice. So, So I definitely gave it a significant degree of thought of moving into a private practice job. And I ultimately moved away from it because I think the draw for me for education and for research, and even the ability to innovate, which you can do in private practice. I don't discount that, especially in the more modern private academic models. But I thought for me, probably sticking back, into that academic model for me, it made more sense.
So kind of taking your first job at Cleveland Clinic, now you're the chair of the neurosurgery program. Can you kind of take us through that journey and how it led to you becoming the chair?
Sure. Yeah. And it's kind of an interesting story that I'll go through, and I'll try to do it sort of briefly because my whole career has been kind of an interesting sort of story. So I started out training at the University of New Mexico with Ed Benzel, my mentor. I wanted to be a spine surgeon when I started training, and I wanted to be an academic spine surgeon. And I was modeling my career after Ed Benzel. I started there because of him. And my first year, he quit. He quit, and he ended up coming to Cleveland Clinic and took me with him. And that brought me here. So I trained under him, and I owe a lot of my early success to him. He's an interesting guy in a sense that he never gave me anything, so to say, professionally. He never put me on a committee, or he never gave me something simple to do. He challenged me. He challenged me to write. He challenged me to do research. He challenged me to be involved in organized medicine. And so I think that challenge, led me to try to accomplish that. Okay, so I trained, and I left, and I came back and into the Cleveland Clinic and worked with him as a colleague and underneath him as well. And I think I continued that drive during my early years of practice. I developed a lab. I was doing spinal cord injury research here at Cleveland Clinic. I continued to be very involved in organized neurosurgery and spine surgery. I moved up the ranks fairly quickly in the Congress of Neurological Surgeons, was involved in the joint spine section, and the AANS, and the Council of State Neurosurgical Societies. And I think, again, he didn't appoint me to anything with that. It was that drive for me to continue to try to take on more, continue to write, continue to do research, and really hone my skills, and try to develop a reputation as a neurosurgeon and a spine surgeon. And he, like I said, he continued to push me through that. And I think that allowed me to be successful. I was appointed to committees. I continued to move up into officer roles. My publications were successful. My research was successful. And I think that helped my reputation. And then at the clinic, again, I was someone who was developing a good reputation. Now, I think what changed for me was taking a risk. So I wanted to move up into leadership. Okay. And at the Cleveland Clinic, it's challenging because, you sort of look at where you are at in sort of the hierarchy. I was the youngest guy, and there were a number of people ahead of me. Moving up into leadership was going to be pretty challenging. And so there was a hospital in town, Metro Health, which was affiliated with Case Western, that was looking for a chief of neurosurgery role. And I decided to take it. And I left the mothership. I left where I was comfortable to go take on a chief role, in neurosurgery. And that job, I did that for 3 years, was incredibly challenging, but I learned so much for that. I was able to take a division of neurosurgery in a department of surgery with a few faculty members and no academia, and recruit, develop a research program. We brought part of the spine fellowship from Cleveland Clinic over to Metro. We became a department in the medical school in the Case Western. I was the first chair of neurosurgery there. And it was really on the job training. So I was becoming a leader, learning what I was good at, learning what I was bad at. I was recruiting, we were building research programs. And it was challenging but rewarding in that I thought, I was successful there. And so because of that, I was able to come back to the Cleveland Clinic, okay? I came back as the head of the spine service line for a number of years. And then Ed Benzel, my mentor, right, who I followed to Cleveland Clinic, who was the chair of neurosurgery at the Cleveland Clinic at the time, stepped down. And so, I threw my hat in the ring as a younger guy into the neurosurgery ring. And I think because of my risk I took going to Metro, the on-the-job training, everything I had done through my residency and fellowship in my career to that point, I was able to, move into and be appointed to the chair of neurosurgery at Cleveland Clinic almost 5 years ago, and to follow my mentor, Ed Benzel, in that role. And the guy that brought me to Cleveland in the first place is just a great story, just sort of closing the circle there. And I think so things I started out in the beginning of my training program, keeping it through, keeping my head down, pushing forward, taking risk. I think that's what got me to this position I am today as the chair of neurosurgery here at Cleveland Clinic.
And I fully agree. I think risk at some point, everyone's professional career needs to be made. Now, thinking back, can you kind of just take us through what was your mindset when you were going through that decision process to leave Cleveland Clinic and go over, next door, so to speak? What were you going through? What were the pros and cons that you were trying to decide on before you decided to make that move?
Sure. It was the scariest time of my life because the Cleveland Clinic, like a lot of facilities, they typically say, if you want to leave, doors closed, nice talking with you. So I always envisioned my career ending here at Cleveland Clinic and leaving let's go through how we phrase it. So the pros were, I was going to go and be a leader and right away, which was what I wanted. I was going to be able to, I was afforded the resources through the job to, with a startup package to recruit, new surgeons and a researcher for my spinal cord injury lab so that I could advance my career on the science end because I was going to get these resources there to do that. But then also build the goal was I got hired to build a department as opposed to division to be able to really take something on that was small and then, recruit into it and develop this thing, which is, I think, pretty phenomenal. There's not a lot of those opportunities out there. More or less we move into existing roles that we can, develop into our own, vision. But here's something that was a small little kernel, that was like, okay, let's make this into something grander, which was pretty phenomenal. So the pros were pretty high. And obviously I was going to get a raise, right? Money does talk. So I was going to, get a little bit more money to be able to do that. The downside really was the risk, right? Like this was risky. I may move into something that I didn't like, right? And that was really what bothered me. What if I didn't like this? I had no safety net to fall back on, right? And I didn't know if I was going to be good at it. Everybody thinks they're a good leader until you become a leader, right? And have to truly lead and have people follow you. I didn't know how well I would do it. And so I had a lot of fear, being able to make that move. And then again, I was moving from a hospital that has a vast degree of resources, which is what we are at Cleveland Clinic. And Metro Health is the county hospital in town. And so not a lot of resources, what's the longevity of this facility? Will I even be there for a career? And so, that was what was going through my mind. The pros were outstanding, but the risks were even almost equally, as significant as well. But like I said, in the end of the day, I talked to family, I talked to my mentors, and made a decision to move forward. And I did it. The other thing too is if anybody who's listening to this or watching this thinks about leaving an institution like this, here's what I did: is I left on good terms. I met with leadership here at Cleveland Clinic, the chief of staff, the institute chair, and told them what I was doing and why, and they supported me. They brought me in actually for a number of months to their business meetings, and allowed me to participate in how they look at the departments and how we review the business monthly, and so it was really eye-opening and helpful, and I left on good terms, and that also helped me come back, when a position opened up.
Thank you so much for sharing that, because I think it's raw stories like that really allow this podcast to be so successful as it is. And now on that same mindset, what would you say were some of the keys to your success that shaped those early years of your career that allowed you to climb to the top of the academic world?
Yeah, I mean, I think it's just heeding people's advice. One is from an academic standpoint, starting early. I started as an intern, writing book chapters, writing case reports, writing case series. I was involved with research, from essentially day one, thinking up ideas, working with my mentors, and leading the studies with them, and then publishing them. I think that is critical on getting into academics and then maintaining that moving forward. And it's kind of developing that work ethic early, right? Because there's so little time to do this. So how do you divide your time between your clinical practice and research and academia? And if you don't develop that early, it becomes too late. You're on the other end of your career and you're looking back and said, why didn't I start a lab? Why didn't I collaborate more? Why didn't I write more? And it's all gone, right? And so I think it's developing that work ethic early, trying to divide the practice such that it's not only a focus on my clinical work, but it's also everything else. And trying to maintain each part of that being successful is key. And I think it's keeping your head down, grinding. To some extent, it's not saying no. And I know that sounds crazy because my screensaver right now, you can't see, says just say no, because I developed a habit of not saying no. If I was offered a project, I didn't turn it down. If I was offered to join a committee, I didn't turn it down. And now my wife would tell you I took on too much, and maybe I still do. And it's hard to be overextended like that. But I think there is some degree of success when you're able to do that and then succeed at it. It does help you continue to move on and move up, and you keep getting something else given to you, or you earn something else. And so I think those were some of the key steps that I took, moving forward, and just continue that. I continued that, through my career, even as today.
Now, as a chair of the program, what advice do you have for the graduating chief residents and fellows entering the professional job market for the first time?
Well, I think one is, again, kind of trying to have them define their priorities. So, and it's challenging for people to really have them define what they want. What are you looking for? And I always tell them it really doesn't matter, I think, on how they phrase it, right? Because sometimes it's different, right? It's location, want to be around family. It's specifically the type of job they want. I want to be a skull-based cerebrovascular neurosurgeon and not do anything else. I want to be in a big practice, a small practice. I want to earn a high salary, and I think I try to get them to look at sort of their priorities and make sure whatever job they're looking for, matches that, and so, if they're going to go to be an academic neurosurgeon, does the job match that? Do they have a startup package? Are you given protected time so that you can work in the lab or work on your clinical research? Does the compensation model fit it, right? So if you're working in a eat what you kill compensation plan, there is a financial disincentive to do anything else than operate. So if you're going to try to build an academic career in an eat what you kill comp plan, those two things sometimes don't meet, and they need to understand. I try to talk to them to understand how those two worlds can collide, and how they can work. Maybe they can work together too, but they've got to understand how that's going to impact them. Understand the practice, the people they're going to be working with. If they want to develop a clinical niche, how is that practice going to help them? How are they going to do that? If they want to train residents, are they working with the residents? Are they working at the main academic hospital? Are they putting out in the community and maybe never have a chance to come back? And so I know I'm being somewhat tangential about this, I guess, so to say, but I think my main advice is trying to get them to understand what they want. Doesn't matter what it is, right? What the priorities are, and just ensure that the job they're looking for matches that. And I think there's things that they don't understand and they need help with, right? And I always encourage them, and just like we were talking a little bit ahead of time, is to really talk to somebody who's a professional, right? Like if you're getting a contract, don't have your brother, who's a a copyright attorney, review that for you, right? So you need to understand, what you're signing up for, deal with professionals to help you, understand it. Make sure it matches your priorities. Again, I always tell, as I looked at jobs, try to define things in 3 different buckets, things you have to have, things you really have to have but can negotiate for something else, and then things you don't have to have, but if you never ask, you never get, and have them put those priorities in those buckets when they negotiate, and meet with professionals. And then I know I've said this now a number of times, but just make sure that that job matches exactly what they're looking for.
Yeah, I fully agree with all that advice there. Now, seeing that we're in the year of the pandemic, what advice do you have for the graduating class regarding the networking and outreaching process when they don't have the ability to go to national conferences and meet folks like yourself?
Yeah, this is incredibly challenging. I mean, this has been one of the most difficult years I've seen for job searches right now, because you're right, we're not out meeting with people. There's no meetings. There's a ton of not a ton of jobs, a ton of people looking for jobs, and limited hiring right now. I think it's probably, there are virtual meetings that are available. Okay. And so, having prospective, applicants, residents, reach out during those meetings, especially if they're on a Zoom type meeting, asking questions, networking makes sense. I think what we've seen, and I think what makes sense is there's been a lot more outreach for prospective jobs. I now receive a number of emails, and then when we have somebody who looks promising, we are setting up virtual meetings so that we can network with them. So I think the residents and fellows now do have to do a little bit more of a proactive outreach to jobs, to department chairs, through other jobs they're looking at, and try to set up some sort of virtual communication, with them. I think is helpful. And then looking at other firms, I guess, or search groups that they can work with to try to set up some of those networking opportunities. So, I don't know if I have great advice other than just to acknowledge that, I mean, it's troubling year, and I think this inability to reach out other than through Zoom. But again, if I look at my current residents, I mean, they understand this virtual world. They're using social media so much more than like we ever did. So, I guess harnessing social media, harnessing contacts that they have at other facilities, and then using these sort of virtual platforms probably makes the most sense in the troubling times. And I would imagine some of this continues moving on as well. We're going to see this in the business world with meetings and such, and probably in our ability to network and interview people. I would imagine some of this is going to continue, even beyond 2020 and 2021.
I've got to give a shout out to my client and your fellow, Dr. Joel Beckett, for getting us in contact first. But I'm curious as to, what do you look for when you're interviewing fellows for your program?
So Joel Beckett, who's phenomenal. So hopefully he's listening to this. Is one of our best fellows we ever had. Obviously he's a spine fellow, and I the fellowship that we look at is spine. So, we're looking for somebody who has integrity. Now, this is hard to judge at times, right? Because especially for somebody who's coming in for a year, right? So obviously we're looking for folks that are intelligent, that have done well, come from, good, high quality training programs. We were looking for academically minded fellows as well. So we do look at academic background. What has been sort of their research? What are their publications been, presentations? Have we seen them at meetings? Now obviously this year, no good, but in the past, have we interacted with them? We want to judge their character and integrity. And we do that some through the interview process, plus their letters of recommendation. Who are they as people? Are they somebody that at 2 a.m. I can trust, because they're leading the residents, that I can trust in a critical situation. We look for people that we can have a good time with. These are people we're around with all the time. What's their personality like? Are they, is this someone I could operate for 10 hours with and enjoy having a conversation with? And that's important as well. And again, I think it's somebody that we want to make sure they're going to go out and represent us, when they're out in their job. They're going to be flying our Cleveland Clinic flag as well as our training flag. And we want to be proud that we train them. So again, is this someone that at the end of all this, we're going to be proud to say, yep, we trained that person and they're out, in the community now, or, at the university, and we were happy to say we trained them.
Now, speaking of operating, there is a human element to being a neurosurgeon. And I'm just curious to know, what advice would you have given your younger self when being in the OR and dealing with unideal situations or complications that don't come out in the way you want them to?
Yeah, I mean, it's hard to say advice. I mean, I guess what would be nice is to give some sort of eye-opening, idea of what it's like. We care for these patients immensely. We're trying to do the best thing we can do for them. The goal is to improve quality of life. And unfortunately, complications do occur. So I guess some advice is just to ensure my younger self that bad things happen. Despite our best intentions, what we do is dangerous, and we have complications. And it's an ability to acknowledge that, that there are going to be complications and bad outcomes, and to provide some assurance that that does happen. And to never lose the ability to have strong feelings about that. I think the worst we can become is callous, right? Where we have a bad outcome and we just, fine, you know what I mean? No big deal. These things happen. Like when I have something bad happen, I can't sleep for days. I think about it in a never-ending way. And I think that's a strong emotion that we can never lose. It makes us human, and it makes us connect with the patient on the other side of that. And so I think the advice is to, one, provide assurance that these things happen. We try our absolute best to never have something like a bad outcome or a complication. That's why we train so long. That's why we perform at the level we perform, is to try to minimize that, but acknowledging that they occur and just never losing that strong emotion or emotional attachment to a bad outcome. I think it's okay to be hurt, to not sleep for a few nights, because again, I think that's showing that we're human, that we're attached to those patients and that we care so much, and we'll work harder next time for whatever happened to never let that happen again. And so I think that's the advice I'd probably give my younger self.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.